Hello everyone and welcome to a new episode of Enjinstarter Saloon, where we explore new and upcoming projects that are launching with Enjinstarter. Today we have ZayaAI with us. ZayaAI is combining blockchain, AI for the medical sector. I'm not the right person to tell you more about it, and that's why I have Christian, the founder and CEO of ZayaAI, with me today. So without further ado, I'll introduce Christian to the stage so he can tell his story. Welcome, Christian.
Hello, Rick. Thank you for having me. How are you? I
I'm
hope
doing great.
everything.
I'm doing great. I'm very excited to learn more about Zaya because we have been talking for a few months now, right? And from the first day that we talked, I got very excited about what you guys are building and the use case especially, and like you're literally saving lives by what you're doing. So I'm very excited to learn more how you're doing it, what you're building, and yeah, and maybe a bit more about your background as well. So maybe let's start there. Um, can you tell us a bit more about yourself and your background?
Sure, sure. Yeah, thank you for giving me the opportunity to talk with you and with your community. I'm really proud of what we have achieved to Zaya till today, and we are doing our best to cut in half the diagnosis time in any pathology lab in this world to resolve the shortage of pathologists that is an issue in all countries in this world, and to reduce the waiting lines of the patient. So the real beneficiary of what we are doing is the patient, although our software solutions and AI models are used by doctors, by real doctors, by pathologists, and not only. You asked to introduce myself. My name is Christian. I founded ZayaAI 4 years ago together with Professor Dr. Sabina Zurak and her team of pathologists. We've met each other and proposed to her to start a company, a startup, to develop AI solutions for pathologists. Various diseases, of course, it is about cancer mostly, but not only. We have AI models for infectious diseases, for tuberculosis, that is one of the most deadly infectious disease in the world. 10 million people diagnosed with tuberculosis. Uh, and Not only cancers and infectious diseases, but also autoimmune diseases. So this is the mission of Zaya, to provide doctors with AI solutions to improve the diagnostic accuracy, to reduce the time of diagnosis in order to save lives, as you said, and to improve the efficiency of medical systems and laboratories, medical laboratories. Who
Yeah.
is me? Um, I was born in Romania. I'm Romanian, but I live outside Romania today. I started being passionate by coding. So I studied a lot software coding when in 80s and 90s, when coding it was like a new frontier of technology. And Then I studied economics because I always has this dream to be an entrepreneur. And I call myself a serial entrepreneur because Zaya is my, I believe, fifth company that I created. Some of them I sold to them with success and with profit. Some of them were failures. Of course, we are learning it in the process of doing things. So practically, I have 20 years of experience in entrepreneurship with several companies, made it exit with the mobile app to Burger King and so on. So yeah, after I developed a lot of projects in digital work, let's say mobile apps and applications, web applications, I decided to um, go in AI, and after a thorough evaluation, I decided to go on medical AI. And I've met my old friend. Mm, he is now a surgeon in Bucharest, and I told him about it, and he said, "Ah, very nice. I can introduce you to somebody that he's happy. She is happy to work with you for research in medical AI." And this is how I've met Professor Dr. Sabina Zurak, being introduced by my school friend that is now surgeon and shareholder in Zaya AI. And this is how we started 4 years ago, just 1 month before COVID pandemic started. Yeah.
Okay. Okay. Maybe just to clarify for the audience, what you mentioned pathologist many times. Can you explain what's a pathologist exactly, or what
Very
does a
good,
pathologist do?
very good question. Thank you for giving me the question. Indeed. So pathology, when I'm referring to pathology, pathology is the department of specialization of medical field, similar to dermatology or cardiology or gastroenterology. Pathology is the golden standard of medical diagnosis. It is called anatomic pathology and is the specialization that is providing a diagnosis based on modifications in tissues of cells in every operatory pieces or biopsy. So, compared, for example, with a CT um, screening method or MRI screening method. That's why I said screening, because CT and MRI are screening, they are not diagnosis.
Yeah.
After the journey of a patient is coming from the first visit to a doctor, is coming through various stages. The last stage, when the patient has, let's say, a tumor, is the pathology. A
Yeah.
pathologist that receive the biopsy of the tumor. The biopsy, the tissue is processed in a certain way in a pathology lab, and it is only a pathologist that is able to provide a very precise diagnosis of the tumor, the grading of the tumor, the special information there that has to be provided in order to that oncologist to be able to design oncology treatment in such a way that is good for that patient. So it is a step, very important step in the process of in the journey of the patient throughout the different stages. It is the golden standard of medical diagnosis. It is the most precise one. It is not a screening, but a final diagnosis. So everything that we develop in ZayaAI as a software for pathologists, it is qualified as medical device. So
Yeah.
we are providing them with medical devices in order to enhance their power. Our slogan at Zaya is enhance the power of pathologists.
And has it always been a focus on pathology, or 4 years ago when you started off, maybe you had another vision?
We started with pathology. Why? Because after we studied a bit the market, we saw that there were a lot of other startups that focused on MRI images, CT images, radiology, X-rays images, and so on. Uh, and we saw that let's specialize on pathology because it's less a field less tried by other. However, of course, we will not stop at pathology. It's just the moment we started, and our specialization today. We are practically develop AI models that use computer vision. That means we are dealing with images. Yeah. And the next stage for us is to enlarge the field of our specialization, including other specialties, like, for example, gastroenterology, in order to mix, but like a tumor board. You know, this is today a cancer is dealt with by a tumor board because we realized that it's so a problem like a tumor is so complex that you need more specialization to work together.
Yeah.
This is the way, this is the future for Zaya, to be a solution for an entire tumor board, not for only pathology, but also for an entire array of medical specialization with the focus to battle against cancer.
Yeah. Then can you tell us how the process went from developing these tools? Because I can imagine that if you want to build an AI tool, you need a lot of data sets to first train the AI and to start understanding what's happening, what are the diseases, where do you find all that data, and how do you technically set that up?
Indeed. This is the most important piece of the equation. Uh, when we talked first with Professor Dr. Sabina Zorak, there was a question of how to choose what kind of diseases to attack. Yeah. And then the next question was okay, and every AI is not just machine learning technique, but that you have to have the best machine learning technique. If that machine doesn't have a good data set for training, it is for nothing. So the backbone of every AI in this world is data. This is 80% of the success of an AI model.
Yeah.
Less about machine learning, more about data. So we started with a contract with one of the biggest hospitals in Bucharest, Colentina University Hospital. They are doing research there because it's a university hospital. And they gave us access to 500,000 different cases, different diseases. So from these 500,000 different cases, we can get millions of images, yeah, from these cases. So practically from that point, 4 years ago, we started to digitalize the database of the hospital to acquire images of different diseases, to sort it out, to store it, to use it in the future for next AI models. We started with tuberculosis AI model that now is preparing to start a pilot with Indonesian health authorities to tackle the problem of tuberculosis in Indonesia. And we have another AI model for bladder cancer that achieved very good result in first clinical tests. We were able to provide better results in identifying tumoral cells inside the blood vessel, comparing with human being pathologies. So practically, we demonstrate that AI could and proved to be a very useful tool in the hand of pathologists.
Yeah. You mentioned a pilot in Indonesia. Can you tell us a bit more about that?
For the moment, we are in the process of, let's say, completing all the details. But there is an epidemic of tuberculosis. They have today 1 million people diagnosed with tuberculosis. But as we all learn in COVID times, when you have one person infected, for sure you have another 9% that are infected, but you do not find them. You do not know that they are infected. So practically, we estimate that in Indonesia today are 10 million people that has tuberculosis in all of the stages. And we propose to them to start a screening program with the help of AI because only with this kind of tools you can process millions of tests per year. Otherwise, there is no health system in the world that is able to process between 2 and 10 million people with human beings and machines and so on. And we proposed them, and we convinced to start a pilot in October to test the assumptions, then to have a real program of screening for 5 years in order to achieve the result of eradicating tuberculosis in Indonesia. Of course, we are not stopping to Indonesia. We are proposing this kind of tools to other governments throughout Asia and Africa and Latin America, because mainly there is the problem of tuberculosis. Although in Europe and North America, they say they eradicated the tuberculosis, there are still several cases, hundreds of thousands that are coming via immigration.
Yeah. And if, like, for example, if Indonesia implements Zaya AI to analyze the data that they have gathered to find solutions, am I correct that this is a tool that they will be using, or will they give you guys the data and you will use Zaya AI to analyze the data?
It is like this. They already give us some data, some Indonesian images of sputum,
Hmm.
and we are now in the process of training our AI model in order to be more accurate in identifying Mycobacterium tuberculosis on their images, on their cases, because there are differences between the process of I don't know, coloration of the slides of sputum between, I don't know, laboratories or from countries to countries, different procedure. And they already give us the images. We are now in the process of improving our AI model to be able on their images to be very accurate. Then there will be like a software as a service. So we will provide to them a platform based on our AI model. They are just uploading the images of the test there, and we'll provide the response that is positive or negative of infection. And if that person it will be positive, there will be a red flag, and they will test also the family uh, in order to find all the active spreading diseases, and they will introduce that patients on the process of diagnosis and treatment.
Yeah. How accurate is the model currently?
We achieve in our clinical test with the current tuberculosis AI model 98% of accuracy. We published a research paper that you can find it on our website as well. And uh, this is a job in AI. This is a job of training and improving accuracy that never ends, Eric.
Yeah.
So uh, I have to tell you that we are implementing a dynamic training. So the more our AI model is processing images, the more is trained, and the better will become.
Yeah. Now 89%, that's very good. Oh, 98%. That's
98,
98.
98.
Sorry. That's already
Yeah.
very good. And I can imagine the more data that gets put in, the better it will become. If if the model predicts a certain disease or finds a certain disease, what is the output it gives to a doctor? Does it say, okay, this is the disease, here's what you got to do, or is it that the doctor got to figure out how to solve it?
It is like that's why I said that our AI models are designed for pathologies because only a pathology can is able to understand it and use it. I can give you two examples.
Sure.
Of course, when a patient is coming in a pathology lab for being diagnosed, it is coming with an entire dossier, with clinical data, symptoms, and so on. So there is a suspicion there
Mhm.
anyway. Yeah. Uh, in the case of tuberculosis, they clearly from the start are looking for signs of tuberculosis infection. Yeah. So it is the job for identifying Mycobacterium tuberculosis in an image of sputum slide or tissue slide is like looking to find a needle in a haystack. Why? Because the bacilla is so thin, and if it is one or two there, it is so hard to be found and so easy to miss that a pathologist spent even 1 hour for a slide to be sure that doesn't miss anything.
Yeah.
Yeah. So imagine that our AI model can provide the result in 10 minutes. So decreasing from 60 minutes to the 6 times decreasing the time of giving a result. So it's better for them to use an AI to filter all the tuberculosis cases that they have that day, yeah, providing a result, and they just check and confirm or not. Much easier and free pathologist time to focus on harder cases, harder cancers to be diagnosed, borderline cases. Yeah.
Yeah.
So this is one example. The other example is for bladder cancer. Our model is not just saying it is cancer or it is not, because this is not a value-added information for pathologists. They can tell it in 30
Mhm.
seconds if the cancer is really obvious. Um, we are providing and we are delivering on the image of tissue exactly the areas of low-grade tumor, high-grade tumor, invasion of the tumor we can find is very important to spot tumoral cells inside the blood vessel. Why? Because when a tumoral cell is inside the blood circulation, that means that tumor is going to metastasis soon. Yeah,
Yeah.
it is very hard for a human being eye to spot that kind of tumoral cells inside the blood vessel. That's why they need tools to help them to find better and faster.
Yeah.
And to imagine that the treatment for bladder cancer is different if you have low grade or high grade. Yeah. And if pathologist is mistaken and he's giving diagnosis of low grade cancer, but in reality the patient is high grade cancer patient, that means oncologist is giving the treatment for a low grade tumor, and maybe the patient is not receiving the best treatment.
Yeah.
So it is very important to be accurate in this job.
Okay. And then how comes blockchain or crypto into the story?
Perfect. I said in the beginning that we are a medical device regulated company or product. So we have to comply with the regulations of in vitro diagnostic and medical devices. That means we have to take ISO standards for cybersecurity, for medical devices to comply with GDPR and HIPAA in the United States. That means very powerful tools for storage of the medical data, securing the storage of the medical data, and securing the communication between Zaya, our servers, and our client servers, and so on. So, looking to the methods to solve this problem, we realized that blockchain can provide some of the methods for us. That Ledger is one of the solutions for us to storage images and medical data there. Of course, they will not be public, they will be encrypted, and they will be we will use a lot of methods to let's say, be sure that any leakage of personal data or medical data is not happening. Um, we started to realize that practically for us, Web3 is a tool can be used in Web2 and AI to leverage, yeah, the technologies. And from that point on, we just realized that it is more there than just security, yeah, and ledger. And imagine and create a token, and we link and we create our verse, our universe, ZayaVerse, we call it. And we are now linking Web2 technologies with Web3 technologies in order to work together. So practically every time our AI model is processing an image of a case, we'll generate a transaction in a blockchain, and everything is happening through a Zaya token.
Yeah. One thing that comes to mind is this platform also going to be accessible for anyone? Like, for example, I'm having a disease. A doctor tells me something, gives me files, but I kind of want the second opinion. Will I be able to upload the data that I received to Zaya and let Zaya look at it and give me the second opinion?
For the moment, no. All the solutions that Zaya is developing are designed specially for doctors. As I said, it is a medical device. A normal patient is not able to use a medical device or interpret result. But yes, you can, as a patient, you can come to us because we have also our own pathology lab. You can come to us, give us your samples for a second opinion. We are using our platform, our pathologist, and our AI models in order to provide to you the best diagnosis that we can.
Yeah. Okay. Okay. I think that could be an interesting extra use case to get the users also involved with the platform.
Look, Rick, I
Something
can give you an example that is real. Confirm you can confirm with others. We
yes.
had one of the investors in seed. His father has a problem, has a diagnosis of prostate cancer, and they wanted a second opinion. And they reached me, yeah. They said, look, we want to check the sample, and in 48 hours we were able to receive the samples to make a diagnosis and to confirm that the first diagnosis of cancer was not correct.
Was not correct.
Yes, yes,
Okay.
yes. It is happening, Rick, in the real life. This is happening, and this is so important why you have to be very accurate. Pathology is a very difficult science and very difficult job to do. And for example, to become a pathologist, you need 10 years of training of medical university, then to have another 5 years of residential to specialize in pathology. And after 10 years, you are just a junior.
Yeah.
Yeah, so it is very complicated. Uh, now inside the pathology, they also are specialized in neuropathology, dermatopathology, gastroenteropathology, and so on, because everything is so complex. There are so many diseases that you cannot know everything.
Yeah. And how do the pathologist itself and the doctors react when they see such accurate analysis?
They, I have I was received a call from some of our clients and pathologists that are using our platform, and they thanks me because I saved them a lot of time, and they have cases that they didn't know how to, let's say, solve it at the first glance, and they use our tools, and we really help them to find a solution and to find a response. That's how it's looking. So everything now has to make the step from classical methods to new digital one. We are providing pathologists with the tools to collaborate each other remotely. Yeah, the information is now can be remotely accessed. They can exchange opinions and facts and information, and this is how we deal and how we solve the problem of shortage of pathologists. It is a very important problem. As I said, it is hard to become one, and practically every country in the world has a problem of not having enough pathologists, and in the end, the patient is the one that is paying this price.
Yeah. Yeah, talking about many countries in the world, what are your plans to expand Zaya and to get Zaya out there in all countries of the world?
Today, we have clients in Eastern Europe, in Romania mainly. We will start in October with Indonesia and in 500 hospitals there. Then, of course, next year we are going in Western Europe as well, and the UK, and incorporating in US because US, for the moment at least, is the largest market in our space. So next year we'll be in United States as well. I can confirm today that we will participate in Düsseldorf to Medica exhibition with a stand. Also, we'll be in London in December to Digital Pathology Congress exposing our products. And next year, we'll make the step in United States.
Yeah, yeah, okay. And what are the long-term goals for Zaya? I understand like the next years you want to expand, but where do you see Zaya in, let's say, 5 or 10 years from now?
This is the most important topic that we have to talk today, Rick. Where we will be in 10 years. And our vision is to become one shop, one-stop shop solution for every AI in medical field. Practically, we will become a marketplace of AI in medical industry, not only for pathology, but we will provide a platform that will be able to use many different AI models like an aggregator for medical specialization, doesn't matter if pathology or cardiology or other specialization, in order to be one single platform, one single solution that will be used by a doctor, doesn't matter what kind of doctor it is, to use it to solve daily problems.
Yeah,
Beside AI, today, we develop a LIS, Laboratory Information Management System, that is designed specially for pathology labs for a very good traceability or tracking of information and of the cases inside the pathology lab. There, we are using not only our computer vision AI models for diagnosis, but also we have speech to text AI that are helping doctors to um, speak to their tools and write the text and save time. So this we are working today to the tools that doctors in 10 or 20 years from now will use it daily as everything that they're using now, the tools, the I don't know, machines. So we are working to make the leap from 2.0 industry to 3.0 industry in
yeah.
digital industry, let's say in medical field.
And what would be the other applications that you see that AI could be used for within the healthcare, but like beyond the diagnosis?
We are now working on a prediction model that will be able to predict the best treatment, the best drug, the best molecule that a patient has to receive for autoimmune diseases, for Crohn disease, for ulcerative colitis, uh, that are very expensive today, and unfortunately, these kind of therapies are not working for every patient. So it is very important to establish from the first moment, based on the biomarkers of the patient, what is the best treatment in order to save not only the patient life and the well-being, but also uh, money and to improve the efficiency of the medical system, because the treatment per year for a patient is more than 50,000 euros per year. So
Yeah,
imagine millions patients are costing billions of euros in Europe.
yeah,
So prediction models to help doctors to provide the best treatment, and also enlarging the sphere of the let's say the focus going from pathology towards other specialization. We are going toward MRI scans, CT scans, and also for cardiology um, uh, tools in order to help other kind of specialists in medical field to provide better not only diagnosis but also healthcare in the end.
yeah. Okay. And what advice would you give another entrepreneur who wants to start something in the healthcare space? And maybe you can be a bit selfish answering this question. You can think of like, okay, what would you like to see built that you can maybe integrate into Zaya then, so you can make like a mega product?
Yeah, as I said, I have the plan to become the first marketplace in the world regarding AI models. Doesn't matter what kind of AI models that any company in today's world is developing for medical purpose. So ready to work with anybody in the industry, because we are now preparing to do this. So we are integrating in our LIS not our own AI models, but we started to talk with competition from North America, for example, to make deals with them to provide to link their AI models in our LIS. So we started to make reality in what we said regarding the marketplace. And this is the vision of ours, to be an aggregator of all AI models for medical field, to provide a very robust, very open platform. And
Yeah.
that's why we are in Web3, because Web3 is decentralized, and guess what? Is the best way to do this.
Yeah. Yeah, before we go into the token and the Zaya token exactly, and talking about the token launch, I would love to understand the business model behind Zaya AI and where you get the revenue from. Because um, I I heard, or I think that running AI, yeah, like AI tools is quite expensive. So
Is indeed,
how is the business model working?
indeed. We are now selling licenses for our platform, depending on what client needs or want. We are designing the solution for them and implementing and deploy it in their own, let's say, environment, either cloud or on-premise. And for example, LIS is coming with 1 or 2 years license. And on top of that, depending on the needs of the client, that hospital, I don't know, uh, we have a pay-per-use model. So based is the license. Then after that, every time our AI models are working for their cases, we are charging them a certain fee per case. And mainly this is the model. And besides that, we also are selling telepathology services. That it means remote diagnosis services by a human being.
Yeah.
And there we are charging per case. So we have a fee per case, depending on what kind of, I don't know, how complex is the case, we are charging them per case.
Okay. Okay. Yeah, that makes sense. The pay per use, because, like you said earlier, one doctor probably saves at least 50 minutes with just using the tool. So
Yeah,
that's definitely
it's
worth
very
paying.
important.
Yeah.
Very important in today's world.
Yeah.
Look, they calculated that the world needs 10 pathologists per 100,000 people. In reality, Europe has only three, so we are at 30% from the need.
Hmm.
America is at 40%. China is at 2. So imagine that pathologists are very busy people,
Yeah.
so they need that kind of solutions.
Yeah. Yeah. Makes sense. The Who wants to become a pathologist? It's like you're playing with people's lives, right? I don't want
I
to have it
said
in
you
my
need
hand.
10 years. You need 10 years of hard work to become a junior one. In that 10 years, we do not have too much money. Oh, okay, then you maybe earn very well, but
But you don't have
10 years.
time to spend.
Yeah, yeah, exactly.
So yeah,
Everybody now wants to become a millionaire in 3 months or six
yeah.
months.
But you gotta keep finding diseases, because there's just no other people left who can do the same job as you. So you just don't have any time to spend the money you
Exactly.
make, and
Yeah,
that's what a Zaya is for. Now I get it. The use case. we, uh,
exactly. This
we,
is this is
we
it.
got to the point.
Yeah, 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 yeah. We
Let's
are
talk
not
about.
replacing pathologies, Rick. It is not
Yeah,
possible. At least today is not possible. Legally, from legally point of view, practically every diagnosis report has to be signed by a human pathologist. So
yeah.
again, our AI solutions are just tools for them to improve their life, to improve the accuracy of the diagnosis, to save time, and to resolve the shortage of pathologists. This is the thing.
But if there's 3 and there is actually 10 needed, and with this tool, with Zaya, they become 5 times more productive. Let's say that's already a step into the right direction, right?
Exactly. Yeah. Yeah.
All
Yeah.
right. Let's talk about the token sale that's coming up. You've probably been preparing for this for quite a long time, because the first time we spoke was months ago.
Yeah.
Um, how has it been? How has it been to in the lead up to a
Oh,
token launch?
like a carousel, like from being up, being down, a lot of work. Practically, I was full percent, 100% involved in this project for public token launch. We are close today. Practically, we covered public round with the list of very good launchpads. We completed also seed and private round, and we are preparing for TGE and public listing when the market will be favorable for
Yeah.
us.
Can you mention who are the other launchpads involved? We know, of course, Enjinstarter is one of them. Who are the
Yeah,
others?
yeah. DAO Maker, Ballpacks, Comunitas.
Ah, yeah. Okay. Okay. We used to do a lot of co-launches with each of those, so that's good. Um, how how did you how did you decide on the valuation of the token?
Well, indeed, it was very important piece of, let's say, decision from our point of view. There was a process that took several months. We started from down to top, first of all, in order to evaluate the revenues, the team, the models, the mm, data sets that we have. You have to understand that uh, that 500,000 of cases of pathology biopsies that we have, it is worth it like a gold mine. So practically, this is our gold mine, the base of our everything that we develop. And then, so practically, we know what is the cost of developing an AI model,
Yeah.
and not at all a small one. And we had one evaluation from that point of view, and another evaluation from the market. Yeah, and we test what the market is saying about what price they will buy and so on. So we arrive at a valuation of $15 million. So 1 5. That I believe is the point where we have a fair price, and but also a bit low than what we can generate very soon. Because look, imagine that next year, starting with Indonesian screening program, we will screen 10 million tests per year.
Yeah.
Multiply with $10 per test.
Yeah.
And you will see that 15 million today is nothing. Is a good, is a
Yeah.
very good time to buy in Zaya.
Yeah.
Yeah. So this is we started to make let's say an average of the price between what is the value in the future and what is the value today of our asset and what the market what is the point of the market is now. And we arrived to the conclusion that having this kind of valuation is it will be very interesting for investors
Yeah.
to
Is the token price linked to the amount of revenue that Zaya makes?
Not directly, because like I said, the formula is more complicated than just the revenues. But of course, revenues is one of the key metrics that we are using.
Okay. Then, if somebody invests in Zaya and they buy the tokens, what can they do with the tokens?
There are a lot of utilities besides Web3 kind staking. They can receive also discounts if they are using token. For example, we are providing 10% discount for all our clients if they agree to use our token to let's say to provide the services. So that's how we will let's say motivate the clients to increase the usage of token. Imagine that if a client, practically the average paycheck per year for a client, it is around 100,000. So 10,000 for every client, it's not a
Yeah.
small amount. So they will be incentivized to use it. So every time they are paying us, they are buying our services, 10% discount if they use. They do not have to have any wallet, any kind of token. We are doing in the back everything for them, uh, but just using our token to let's say like a yeah, to give life to entire system. So you can investor can check our white paper to see what we offer. There are a lot of other utilities. We have also premium membership club for the one that are involved more with Zaya ecosystem, with token, with NFTs and so on. For them, we are providing certain benefits and a lot of very good utilities you can discover in the white paper.
Okay. Talking about the white paper, where can people learn more about Zaya?
ZayaBlockchain.com.
ZayaBlockchain.com is the website. All right. And
Yeah.
in terms of community?
Twitter, ZayaPathDX, Telegram, ZayaAI, LinkedIn, YouTube, all these channels you can find us.
Okay, you mentioned Telegram there. I want to experiment with something new we haven't done before during this Enjinstarter Saloon. Um, but I want to give away some allocations in the Zaya IDO. And we have not prepared this. This is just me improvising. But if you go to the Zaya Telegram channel and you mention the code word AI Doctor, so the code word AI Doctor, and you add your wallet address, in the Telegram, the first 10 people who do this will get a $100 allocation into the Zaya AI IDO on Enjinstarter. So the only requirement is that you are KYC verified by the time the IDO starts. So go now to the Telegram channel of Zaya AI, say the code word, drop your wallet, and maybe you're one of the lucky first 10 ones. If you listened all the way through this episode, then you are one of the lucky ones. So go do it now. Find the Telegram channel and say the code word AI Doctor with your wallet address. This is something new. We haven't done this before, but I think it's going to be a fun experiment, and you might get some new visitors onto the Telegram channel.
Very nice, very interactive indeed.
Is there anything else that you want to add? Any final thoughts that we have not discussed yet?
Looking to see the feedback of community, we are there on media channels, Telegram group, Twitter, and so on to answer to all the questions that members are having. We are open to any suggestion that can improve our project, and we are ready to public listing and to increase and to build on Web3 and to really become a project and be a project that are using AI in Web3 and real world assets that are coming to Web3 to prove the possibility that Web2 can benefit from Web3 technologies.
Yeah, yeah. And we're talking about listing of the token. We haven't talked about that yet. Did you mention that you're waiting for the market to show when it was a bit more favorable for the token listing, or did I understand that wrong?
Yes, you're right, indeed.
Okay. And do you already know where you will be listed? What exchanges and also what chain?
We are on BNB chain.
Yeah.
Yeah, the token is minted in BNB chain. And for sure, we will have MEXC as a centralized exchange to list. And we will have another, for sure, at least one other
Okay.
centralized exchange, but not want to mention today because there are still discussions.
Yeah. And then on a decentralized exchange, I expect it will be PancakeSwap, right?
For sure.
All right. Okay. I think we touched upon all the subjects that we wanted to talk about. I got a much better view on what's the vision behind and what is Zaya doing exactly and how will it improve the world and the world of healthcare. So I'm very excited to see how it's gonna change lives, save lives, better save lives than change lives. Yeah, and thank you very much for your time. I also thank everybody for watching. Thanks for watching. I hope you were one of the first 10 to join the Telegram channel, and I hope that you all will participate in the IDO that's coming up on Enjinstarter very soon. So thank you very much, Christian. And